We'll go ahead and get started. Thank you everyone for joining. Welcome. My name is Alessa Holler, and I am a program analyst at Healthcare Ready. We greatly appreciate your participation today in joining Dr. Anel Prim's discussion on the social determinants of mental health and the fallout from the COVID-19 pandemic, which is the second event of a series under Restoring the Healthcare Workforce for Equity program. We want to make sure this is valuable time for you all. So this is how we plan to spend the next hour. After brief opening remarks, we'll dive right into the webinar, followed by a Q&A session. A couple of housekeeping items before we begin. We'll be continuously looking at the chat, so please feel free to post any questions or comments throughout our time together. If you'd like to make a verbal remark, please raise your hand so that we know to call on you. The more that you post in the chat and contribute to discussions today, the more beneficial we feel this conversation will be for you all. And it will also help us adjust and deliver recommendations that are most applicable to your experiences in healthcare settings. I'll now hand it over to my colleague, Angie Im, Healthcare Ready's Associate Director of Programs and Policy.
Awesome. Thanks so much, Alessa, and welcome. Thank you everyone who's joining us in this discussion today. For those of you whom we haven't had a chance to meet yet, I'd love to take a moment to briefly introduce Healthcare Ready and our work in preparedness and response. Healthcare Ready is a nonprofit 501c3 organization. We were founded in the wake of Hurricane Katrina, following the recognition that there needed to be better collaboration and coordination happening between private sector healthcare, government, and emergency response entities to make sure that patients continue to have access to healthcare services before, during, and after disasters. So today we serve as a linkage point, ensuring necessary discussions are happening between government, businesses, and response entities across health and public health. We're available to support you and other healthcare facilities in planning, preparing for, and responding to disasters. So don't hesitate to reach out to us beyond this webinar also. Today's discussion is brought to you through our program on Restoring the Healthcare Workforce for Equity. It's funded by the Center for Disaster Philanthropy. This is Restoring the Healthcare Workforce for Equity is actually one of a few programs that we have at Healthcare Ready that is specifically geared to capacity building for health centers and clinics. So this program and these webinars that we'll be hosting, there's more to come. Please keep posted and sign up. Is seeks to highlight the challenges the healthcare workforce has experienced throughout the COVID-19 pandemic and in their current phase of navigating recovery. The webinars and research being conducted through the Restoring the Healthcare Workforce for Equity program will have a special emphasis on providing support and resources for communities that are hard hit by COVID-19, including communities of color, members of the healthcare workforce who are from communities of color themselves, and all frontline healthcare workers that serve patients in health centers and clinics across the country every day. We hope you'll stay connected with us and join us for future webinars and findings from our research on the healthcare workforce. And so without further ado, I am happy to introduce our amazing guest speaker and friend of the organization who will be speaking with us today on the important topic of social determinants of mental health and fallout from the COVID-19 pandemic. Dr. Anel Prim is a community psychiatrist and chair and convener of All Healers Mental Health Alliance, a group of mental health professionals, health advocates, first responders, and faith community leaders that facilitates the culturally aligned responses to the mental health needs of historically marginalized communities affected by disasters, both natural and human caused. Dr. Prim, thank you for leading this discussion, and please, I'll hand it off to you to take it away.
Thank you so much, Angie, for the kind introduction and for this partnership with Healthcare Ready. It's a pleasure to work with you all. And I'm really pleased to be here today and to speak to the audience. Good day to all of you and welcome. I'm very excited to share with you this presentation on social determinants of mental health and the fallout from the COVID-19 pandemic. So here's an overview of what I'll be talking about, mental health, mental illness, and the social determinants of mental health, the COVID-19 and its disparate impact on communities of color, and the fact that it was devastating for the whole nation and really the world as well. Societal context and the mental health impact specifically of COVID-19. And it's also important to understand the historical trauma, its historical context and some of the associated trauma that communities go through that are hard hit by COVID-19. And then, of course, it's important to focus on the positive. What do we want? Protective factors and prevention to the extent possible. And I will also leave you with various tips, practical tools, and resources for self-care and for well-being. So before I get started on the presentation, I would like to initiate a poll with you all, just a simple question. Let's just get all on the same page about mental health versus mental illness. And the question is, which of the following choices are true regarding the similarities or differences between mental health and mental illness? And so there's a single choice. I'll give you all a few seconds to make your selection.
Oh, Dr. Prim, it looks like the poll did not launch. Natalie, do you mind please launching the poll?
I got it on my end.
Okay.
Oh, great. Thank you, everyone.
And for anyone joining by phone, if you're unable to see the screen, the poll reads, which of the following choices are true regarding the similarities or differences between mental health and mental illness?
All right, we'll give it a few more seconds.
Sounds good.
Okay, I'm gonna end the poll now.
All right. Thank you all very much for that. And as we can see, I think most people chose mental illness is maybe exacerbated during disasters, followed by all of the above, and the impairment answer. So we'll revisit this question a little later, and we'll go from there. So thank you all for completing that. So let's get started. So what is mental health? And believe it or not, even as a psychiatrist, I didn't even think about what mental health was until I was, well into my career. I was so focused on mental illness and treating mental illness that I didn't stop to think about what mental health was. And fortunately, former Surgeon General, Dr. David Satcher, issued a wonderful report on mental health, I think back in the late 90s, early 2000s. And mental health is defined there as involving effective functioning in daily activities. And I want to underline that word functioning, which is so important. And it relates to productivity at work, school, and caregiving, and in community, wherever people are. Healthy relationships, being able to establish and maintain healthy relationships. And I think underscoring this is important too, the ability to adapt to change and cope with stress and grow. And this is something universal. We all have to adapt to change. We're confronted with change. We're confronted with stress. But the key to mental health is actually being able to adapt, to be flexible, and to cope. So what about mental illness, which is not exactly the opposite of mental health? Mental illness involves changes, important word, changes in people's emotions, their thinking, their behavior, or a combination of all three of those. And when some of you think about mental illness, you might recognize that any and all of those factors or those items can come into play. Another aspect of mental illness, which is so important, is distress and or problems functioning. Again, that word functioning in our lives, whether it's in a social setting, the workplace, at school, or in family activities. So what are the social determinants of mental health? Some of you may not be familiar with this term, but it is indeed very similar, almost synonymous with the social determinants of health. And I think most of you also know that there's no health without mental health. Mental health is such a critical ingredient of our overall health. And as such, it connects with education, economic status, housing, food, and healthcare access. I think you can imagine if there's anything awry with any of those items that I just mentioned, that it can have an effect on the mental health of the individual. I do want to underscore that aspects of social determinants of mental health include discrimination and social exclusion. And these can come in different forms, for instance, racial segregation and redlining, where largely Black and other communities of color are relegated to undesirable places to live, and as a result have different opportunities and different access to resources, and also greater exposure to harms, mass incarceration, police brutality, environmental racism. These are all examples of social determinants of mental health. COVID-19 certainly was just a humongous disaster, unprecedented, the massive proportions that it took. And it had a significantly disparate impact on marginalized communities in terms of the illness, the death, the loss, and the grief that occurred in the aftermath. And in addition, again, talking about the social determinants, it was educational and economic fallout. And an example of that is nearly half of Black people experienced economic challenges, which was more than double of that of their white counterparts. And we need to understand that this is not happening in a vacuum. It's happening in the context of a long extended period of, essentially centuries and layers of inequities. And I think many of us are familiar with that. But focusing on COVID-19 in terms of infection, hospitalization, and death, this is a chart that comes from the Centers for Disease Control, which shows here the higher risk for COVID-19 infection, hospitalization, and death in certain racial and ethnic groups. I would highlight here the higher risk within the indigenous community, both for cases, or all three cases, hospitalization and death, and also among the Black community and the Hispanic or Latino community, where we're seeing higher rates of illness, hospitalization, and death. And I note here that the Asian community, there was less risk compared to the white population. The next slide will show COVID-19 cases by race and ethnicity, specifically some of the cumulative mortality rates. And we can see here, looking at this bar graph, the higher rates of death within communities of color compared to the white population. But I would like to underscore that across the board for all racial groups, the COVID-19 pandemic took just a significant and devastating toll on our nation. But when we zero in on the disparate impact of COVID-19 in communities of color, we see that these higher rates of infection and mortality have led to a greater loss of loved ones and grief. We also know that essential workers, very high percentage of whom are people of color working in industries such as public transportation and in grocery stores, and certainly on our healthcare workforce, had greater risk of exposure to COVID-19. And unfortunately, they had less ability to work from home because their jobs require them to engage with the public. There was also disproportionate financial adversity and stress due to unemployment. Many people lost their jobs, and also crowded housing conditions were another risk for the spread of the illness. What about the impact on children and youth? Well, as we all know, COVID-19 caused virtual learning to come into play. This caused a lot of anxiety and uncertainty among children and their families. Many families had limited Wi-Fi or access to devices that would allow them to comfortably engage in their academic activities. And on top of that, lack of social contact with friends. In some cases, supervision of children was a safety issue if their parents had to show up for work and there was no one to care for them. And then also, there were some instances where teens were lured to take on jobs and make $25 an hour. That was a pretty compelling opportunity. And then they weren't doing their schoolwork, which further jeopardized their status in learning. And so this learning loss has led many children to be left behind. And unfortunately, this has been a disproportionate impact in communities of color as well. I'd like to note that discrimination and attacks against people of Asian descent was very common during this period. It was terrible. There was some episodes of bias and even medical decision-making, because we know that among communities of color, the rates of chronic diseases tend to be higher, and they may have been seen as a sort of poorer prognosis because of their pre-existing conditions, and perhaps decisions were made not to give them perhaps life-saving equipment that were very much needed and in great demand during COVID. And so other concerns there, high rates of infection in some indigenous communities, particularly those that may have had challenges accessing healthcare, as well as some of the utilities like running water, in order to be able to protect themselves against contracting COVID-19. And then among undocumented families, there may have been challenges about seeking medical care for fear that they might be apprehended by immigration authorities. And so we think about the impact of COVID-19 in communities of color, and really all communities. Physical distancing was required. I mean, some people say social distancing, but I didn't use that language because it's so important for humans to be connected. We are relational creatures. And so even if we couldn't be in each other's physical presence, hopefully we stayed in touch by phone or other communications means. But people at a time when people were so stressed and so worried, they did not have the opportunity to come together and be able to hug each other and be in each other's presence, which can be so comforting during trying times. 40% experienced stress, anxiety, or great sadness. And for those who had pre-existing mental illness or substance use disorders, there was the potential for those conditions to be exacerbated during this highly stressful time. And we also saw a rise in suicide amongst Black people in certain jurisdictions. And this was superimposed on already alarming pre-existing trends of increased rates of suicide among Black children and youth, as well as among LGBTQ youth. I'd like to just call our attention to some of the common symptoms of long COVID, because even if people were able to survive COVID and get through it, some have experienced ongoing symptoms of things like fatigue and brain fog, headaches, joint pain. And in some cases, this could prevent people from working. And so long COVID has become a disabling condition. And in fact, over 10 million people, it is estimated, will have long-term effects of COVID, including physical, mental, and neurologic disabilities. This is associated with extended periods of unemployment and compounding pre-existing economic, employment, and wealth disparities. And just to give you a figure for the percentage, 45 to 50% of the most severe COVID cases will have a variety of disabling symptoms 6 months later. And what some recent reports have shown is that communities of color are bearing the brunt of long COVID, and they're less likely to receive outpatient rehabilitation due to some barriers to access, transportation, and racial bias. And these are things that we even have seen before COVID. Getting back to young people again, I think it's very important to be aware of what they are going through from their own reports. And the CDC Adolescent Behavior and Experiences Survey, also known as ABES, showed that there were elevated levels of emotional distress, suicidal thinking, and attempts among high school students. And what stood out in the students surveyed was the fact that girls and LGBTQ youth had high levels of these experiences. Something that really surprised me about this survey was that the majority of teens reported being emotionally abused by a parent or a caregiver, and that 10% of teens reported physical abuse. There was also information specific to students of color compared to their white peers. They were more likely to report being mistreated at school because of their race or ethnicity, and being less likely to receive mental health services through telemedicine during the pandemic. And as we all know, telemedicine was a very important tool for people to get access. But it appears that even during the pandemic with this resource, we see a pattern mirroring what we saw before, and that is disparities in access to mental health care. This is a very sad statistic, the caregiver loss during the pandemic. And out of 200,000 children, about 1 out of 500 under 18 lost a caregiver to COVID-19. And this includes grandparents, parents, custodial grandparents, grandparent caregivers, et cetera, who provide children's home and basic needs, love, security, and daily care. And there were stark disparities in caregiver deaths by race and ethnicity, with the majority of young people experiencing this are people of children of color at 65%. So we're even seeing disparities, racial disparities in terms of caregiver loss, and grief. And this tees up another Surgeon General's report recently released on our epidemic of loneliness and isolation. And even before the pandemic, about half of US adults reported experiencing loneliness. COVID only intensified this. And, these physical consequences of isolation are very concerning. Things like, increasing risk for heart disease, stroke, dementia, as well as premature death. And certainly the mental health consequences of loneliness are significant in that they increase by 50% the risk of depression. And so this is something we need to pay attention to. And I think COVID has really sensitized us to the importance of looking at isolation and rectifying that. So here are some of the other things occurring in the context of the pandemic: racial injustice and mass violence events. There was a succession of killings of unarmed Black people and other people of color, and the horrific violence, mass violence occurrences in Buffalo and Uvalde. This has released kind of unprecedented collective trauma across the country, causing anxiety, anger, depression, stress, fear, and just worries about our safety. Okay. I think all of us, felt this because it could have been any of us that this happened to. And some people were motivated to protest peacefully, but in some cases, this exposed people to the vulnerability of injury themselves or arrest. So again, this is all in the backdrop of what was happening while we were dealing with COVID. And just a note about, the impact of mass shootings on mental health. Certainly, they can cause adverse psychological outcomes in survivors as well as in the affected communities. It's not surprising that people would have fear and declines in perceived safety. I've spoken with people from Buffalo who didn't want to come out of their homes for weeks after the Buffalo shooting. And certainly risk factors for adverse psychological outcomes include being female, having psychological concerns prior to the incident, being closer to the attack, and also being acquainted with people who passed away. And so having social support and having good emotional regulation and mental health prior to such a tragedy is predictive of a good psychological outcome. And so, when I've talked about the societal context, but, it's also important to consider the individual context and what sort of traumas might they have had in the past. And, here, defining trauma as a harmful physical or psychological experience that has a lasting effect on mental health. Historical trauma, in contrast, are traumatic events experienced by a specific cultural, racial, or ethnic group. And when we think about both the individual trauma and the historical trauma and intergenerational trauma, and just the carryover from what has happened in the past to communities of color and diverse communities, the transatlantic slave trade, the Holocaust, apartheid, the Trail of Tears, where indigenous populations underwent forced migration and colonization, the Japanese internment after World War II. All of these things have been associated with extraction of people from their native lands, and extraction of labor, displacement, separation of families, genocide, sexual violence, and torture. And so it's no surprise that these things would have an impact on mental health. Dr. Arlene Geronimus of University of Michigan has talked about this issue of weathering and allostatic load. And she did some of her research in Black communities looking at the cumulative impact of repeated experiences of social and economic adversity, having a result of deterioration of health and racial inequalities in health that are not explained by racial differences in poverty. And allostatic load is a term often associated with weathering, which describes the physiological burden of constantly having to adapt, to multi-layered stressors. And this is one way to measure weathering. Another related issue is adverse childhood experiences. Some of you may have heard this referred to as ACEs, and these are traumatic events that occur in childhood, particularly when the child is going through a trauma and does not have adequate adult support. This activates a stress response, which is toxic. Some examples include experiencing violence, abuse, neglect, witnessing violence, having a family member attempt or die by suicide, and any environment that might undermine the safety and stability of the child and their bonding. And there's so many examples of this with substance use disorder, mental health concerns, parental separation, and such as household members being in jail or prison. And when we think about this, for those of you who are healthcare workers and serving patients and thinking about the situations in which your patients and their families, what they are living through, some of these issues may come into play. And all of this toxicity has an impact on a child's developing brain. It can affect their ability to learn, their ability to make sound decisions, their responses to stress. And research has shown that later on in life, in adulthood, children who have experienced ACEs may, or at least have a higher risk of chronic health problems, mental illness, and substance use disorders. This can impact their educational opportunities and performance, job opportunities, earning potential. And just to give you a sense of how common this is among adults, 61% have experienced at least one ACE. Nearly 1 in 6 report 4 or more ACEs, and women and people of color are at greater risk for having experienced 4 or more ACEs. But I have good news, though, that risk factors are not predictive factors because of protective factors. This is a statement that former Surgeon General Dr. David Satcher has made, and it certainly rings true, that if we can employ predictive factors, and when something bad happens to someone, if we can step in and make sure they have sufficient support and unconditional love from their family, or for children, a caring, responsible adult, providing adult protective shield, which is the #1 bullet under protective factors, this can buffer those stressors and those toxic events. And so, you see this list of risk factors, ACEs, being bullied, having financial stress, experiencing racism, discrimination, xenophobia, homophobia, and transphobia, isolation, violence, being a victim or a witness of physical and mental illnesses, loss of a loved one. These are all the protective factors that can be employed. It may look different for each person, but these are the sort of things we should think about when we encounter people in our lives who have gone through difficult times, traumatic experiences. There are things that we can employ to buffer that. Now I want to turn to you. The mental health of healthcare workers in COVID-19. There was a survey done by Mental Health America on over 1,000 healthcare workers. And what they found was that indeed COVID-19 had an adverse impact on the mental health, not only of the nation, but of the healthcare workforce, with most, the overwhelming majority being stressed out and stretched too thin. Experiencing stress, anxiety, frustration, exhaustion, and burnout, and being overwhelmed. Healthcare workers were worried about exposing their loved ones. They were emotionally and physically exhausted and drained from the kind of loss and illness that they were seeing. They didn't have enough emotional support in many cases, and some of them struggled with parenting during the process. And this reminds me in general of the Surgeon General's advisory on workplace mental health, where in a 2021 survey in the middle of COVID again, that 76% of US workers reported at least one symptom of a mental health condition, and this represented a change from 2 years prior with a 17% increase. And so again, focusing on what we can do, creating workplace cultures that seek to protect workers from harm, physical and psychological safety, and engaging in diversity, equity, inclusion, and accessibility. I know that even that term is under fire now, but this is important. Our nation is a diverse nation, and we need to value everyone. Connection and community, inclusion, belonging, collaboration, and teamwork, all are very important. Work-life harmony, mattering at work, making sure people have a living wage and have some say in decisions, are recognized for what they contribute, and certainly opportunities for growth, training, education, mentoring, and advancement. And so again, the Surgeon General has been providing so many wonderful resources for us. And this one, looking at health worker burnout, the importance of empowering health workers to be responsive to their voices and needs, eliminating punitive policies for seeking mental health and substance use care, protecting their health, safety, and well-being, removing administrative burdens to make them more available to their patients, communities, and colleagues, and also really centering the importance of social connection and community as a core value. And so, of course, on the individual level, there are things that we can do for ourselves too. Nutrition, physical exercise, rest and relaxation. Most Americans don't get enough sleep. That's certainly something that we can do that's good for our brains, good for our mental health. Things like yoga, mindfulness meditation, breathing exercises, visualization techniques, social connection and social support, which is so important for everyone's health and well-being. Taking walks in nature, getting sunlight, that helps our vitamin D and overall wellness, journaling, and limiting toxic media exposure. There's certainly a lot of that out there. And so we really need to be conscious and balanced in that. And so I'll leave you just with some tips, practical tools, and resources. Let's take a preventive approach. That's what public health is all about. We want to keep people out of harm's way and remind ourselves that risk factors are not predictive factors because of protective factors. We can employ protective factors to mitigate some of the bad things that happen in life. We can create psychological safe spaces in the workplace. We can implement psychological first aid, where we focus on restoring calm and safety, and encouraging people that there are things that they can do themselves, self-efficacy, and there are things that they can do collectively for collective efficacy, working together, collaborating, being connected, and having hope. These are all aspects of psychological first aid, and certainly mental health first aid, making sure that we know what it looks like when one of our loved ones or coworkers or neighbors is experiencing a mental illness and how to get them help. Utilizing mental health apps, they are readily available. Accessing telehealth resources, which greatly expanded during the pandemic, and I believe really increased access to mental health services because people didn't have to go anywhere, and there was less stigma of having to walk into an office or a clinic that said mental health on it. They could access it in the privacy of their homes, and certainly seeking out mental health support and crisis services, which are included in the resources that will be shared with you. And so here are some takeaways. The COVID-19 pandemic was a devastating disaster that led to high levels of morbidity and mortality, including long COVID, and the adverse impact on mental health. It exposed and intensified what some of the pre-existing racial disparities have been, especially in the negative social determinants of mental health. So just be mindful of this disproportionate impact in communities of color and on essential workers, which include healthcare workers, and employing preventive measures, protective factors, such as connection and social support to promote well-being. And so before we end, I'll try again to do the poll. If not, my colleagues at Healthcare Ready will maybe launch it. I think I see the previous one, but we're asking the same question again. I think I'm going to need your help because the one that keeps showing up is the previous one. Okay, so we'll give folks a chance to answer the question.
Dr. Prim, would you mind narrating the question for those of us?
Yes. The question is, which of the following choices are true regarding the similarities or differences between mental health and mental illness? And there's a single choice for this. I'll give people a couple of more minutes. Excuse me, a couple more seconds, not minutes.
Okay, I'm going to close the poll out now.
Okay, thank you. It looks like a few more people. I'll give you what the correct answer is. The correct answer is D, that mental illnesses may be exacerbated by disasters. And so I appreciate everyone participating in the poll and for contemplating this issue. I know it's kind of tricky. But hopefully with what I have shared with you, that it gives you more of a sense of the social determinants of mental health and how that comes into play in our lives in general, but particularly in the lives of healthcare workers and the people that they serve. So with that, I just want to thank you for listening, and I would be happy to entertain any questions that you have.
Thank you, Dr. Prim, for such a great presentation. I particularly found the statistic that 61% of adults have experienced one AC very surprising. But I'm also reassured that, because of the protective factors that are available. So thank you very much for pointing that out. We do have one question from Sue about whether the slide deck will be available. We will be sharing the slide deck and the recording with you all following today's event. I now invite anyone else from the audience. Please feel free to drop a question in the chat or simply raise your hand to ask a question verbally. All right, Whitney.
Yes, hello, good afternoon. My question was about suicidal thoughts and attempts among children. First of all, I found that really disturbing, but unfortunately not surprising. I actually used to be an elementary school teacher. And for a time, I feel like when we would see that type of thing, it would be mostly among teenagers. But I guess as a result of the pandemic, my question is, were suicidal thoughts and attempts reported more often with younger children too?
Well, actually, just in general, suicide did not go up during the pandemic. And that was a surprise to some people. It actually went down. And maybe that's because families were spending more time together. There was more togetherness. They might have been kind of holed up in their homes, but that was one of the potential benefits from COVID. However, we did see some increases in suicide in the Black population. And then prior to the pandemic, we saw some disturbing trends in increase in suicide among Black children in particular, which was extremely alarming. So, the answer to your question, I had to kind of segment that, and also just to point out that prior to the pandemic, there had been a decade of increasing suicide attempts among Black children, whereas all the other racial groups, young people, their suicide attempts were going down. So it's a little complicated picture, but we're concerned about any suicide at all, and particularly in young children. And we're seeing these trends, which has really heightened the need for us to provide more mental health resources, especially in schools, so that families might have difficulty accessing mental health services, but when they're embedded in schools, that's really an ideal opportunity for children, to receive the supports that they need.
Mhm. I feel fortunate that I work for an FQHC that actually has over 30 school-based counselors in like 28 schools. So, and we definitely are busy, unfortunately, but I'm glad that we can be there. Something else that I saw during the pandemic, and I read this article, but I feel like I saw it several times, was that when people were being surveyed about returning to work in person, I think the results were saying that a lot of Black people did not want to go back to work. Can you speak to that at all?
I could only speculate on why that is, but I did not see that report. And I'm wondering if what the conditions were in the workplace. I know that in some workplaces, the conditions and treatment of Black workers is unequal, and at times discriminatory. I don't know if that was the reason, but I'd love to see that resource where you read that. And I think across the board, many people were reluctant to go back to work after the pandemic. It's, especially after being able to to work from home. That certainly gives, I think, most of us in our lives a lot more flexibility with our family obligations and caretaking and so forth. So I don't know that was limited to Black workers. But I have a sense that it may be tied, if it's beyond that, that convenience and flexibility, whatever the working conditions were, and some of the challenges. I've also heard that people not being in the workplace is a disadvantage too, in terms of advancement, because you may not have the same opportunities to engage with other colleagues and with supervisors and mentors and so forth. And so that could actually impede someone's progress and advancement. So I think that's really a multifaceted issue, but I think the possibility that there are racial disparities in reluctance to return to work is something worth examining further. I've also heard of the great, what is it called, the great quitting or something like that. A lot of people quitting their jobs since the pandemic. So that may be a little different than your question, but thank you for your stimulating questions. And I see there's a question from Lori.
Before we go to Lori, Barbara, did you want to comment, ask, or say your comment?
Yes, thank you. And I'm
Mhm.
sorry, I didn't know where the raise the hand icon was.
No worries.
First of all, it was a fabulous presentation, but I wanted to go back to the suicide rate in children. I sit on the board of a not-for-profit organization that provides behavioral health to children up until the age of 18. And during COVID, in the initial stages of COVID, our suicide rate went up 100%. And then towards the end of 2022 and the first 2 months of 23, we saw it start to come back down. But when we moved back to normalizing operations and life, the suicide rate went back up again. Because we don't believe that the resources were there or the guidance was there to help people understand how to move back to full-time school, not a hybrid, was questionable about whether telehealth medicine would continue to be covered. As we began to take those exemptions away, people were kind of stuck. So we did see a 100% increase, and we also saw it moving down to children as young as 11 and 12. And we've kept all those dashboards for this reason. We've been very good about keeping dashboards for this.
Well, thank you for sharing that. You know, as you probably know, when suicide data is gathered in aggregate, you don't get to see perhaps a community where there's a very different picture. So thank you for pointing that out. If you don't mind sharing, where are you located?
We're an organization that serves in New York City, the Bronx, and we also serve upstate New York, Dutchess County, Rockland County, Ulster County. So part of it is rural, part of it is urban.
Thank you.
Thank you, Barbara. We'll go to Lori next. Lori, do you still have a question?
I think we can move on. Lori, feel free to speak up when you come back. And next, I'll pass back to Alyssa.
Thanks, Angie. We do have time for one more question. So in case one comes in, I'd just like to read a comment in the chat from Nikki, who says a couple positives that did come out of COVID-19 is more awareness of mental health illness and increased employment for people with disabilities. And I think that really stresses the importance of communication and raising awareness for topics and subtopics we discussed today.
I would agree with that. I mean, that's a really positive development from COVID. And, you know, all of these Surgeon General's advisories that have come out, there was one that I didn't mention that was on youth mental health, which I also recommend. That's a rich resource as well, that, you know, very comprehensive, that talks about different aspects of youth mental health and what can be done in different sectors to support it. So would recommend that resource to you all as well. But thank you for pointing that out. That is, and that's wonderful news for a psychiatrist, because in many ways, you know, we were, I'll just say, sort of the minorities of medicine, in that, you know, there was a time when people didn't want to go into psychiatry, or they would ask you, well, why don't you go into another specialty? You know, and that, I think, related to stigma associated with mental illness and kind of people being in denial about it. But it has taken this long for people to see, you know, just how critical mental health is, and how critical healthcare professionals who provide mental health services are to our communities and our nation.
Exactly. Thank you for that. Kareem, if you're able to come off, unmute, we're happy to give you the.
Hey, thank you. I'm sorry. I mean, I thought it was my coworker. I thought my name was coming up. So I'm sorry about that. So the question I have to ask when we was talking about equality in the communities, something that I realized when I was trying to start a business is how hard it is to raise venture to start a business. And I don't feel you can truly be equal when your neighbors are homeowners and business owners and you're stuck being an employee. And what I mean by owning a business, I don't mean just opening a little mom and pop shop. I mean trying to do something really big. I was in that field. I have biotech patents, and I was out meeting with investors, going to networking events, being invited to pharmaceutical companies. And I realized at a point this is going to be almost impossible to raise venture. And I realized why. I had people pretty much tell me that indirectly, personally. So how can you truly be equal to say we're going to have everybody be equal when you're forced and stuck on just being an employee? Because you can't be equal that way. If you can't be the next Elon Musk, if you have the passion, the smarts, and the innovation of him, if you can't be him and only non-minorities can be him, how can you be equal? If you just can only be an employee.
You're raising an important question. When I mentioned the social determinants of mental health, one of them was economic. And some of the barriers to economic prosperity, I'll say, is felt in many communities of color, and it has a history tied to it and certain structural inequities that are in place. Many people are now advocating, to change that, so that people will have pathways, to be entrepreneurs and, successful business people. And I've learned that in some communities, they're teaching children some of those skills about, finance and economic development and business skills and so forth, so that it can start early. Even if their neighbors are, no matter who their neighbors are, that they would have a shot. But some of the inequalities in our society, that is a reality, and that can be a barrier. I don't have the answers to what will change that, but I think that people working together and in partnership across systems, that's what it's going to take, and people of goodwill and good conscience who are extremely wealthy to be able to share some of their knowledge and perhaps make investments. I mean, there are some examples of that happening, and hopefully that will continue, that policies within our society will be mindful of that. But I will admit, in the current environment, it's a challenge. There are differences of opinion about the way forward, to be more inclusive, to give everyone a chance for the kind of economic success that you described.
Okay, thank you.
Thank you.
All right, it looks like we are unfortunately at time. So on behalf of Healthcare Ready and AHMHA, thank you very much, Dr. Prim, for a thoughtful discussion, and everyone for attending. We will be holding 2 more program events this month, which we hope you can join us. On August 16th at 2 p.m. Eastern Standard Time, guest speakers, Dr. Angela Settle, CEO of West Virginia Health Right, and Shayla Leftridge, Director of Community Outreach, Diversity, Equity, and Inclusion of West Virginia Health Right, will speak from their experiences on steps clinics and other health organizations can take to assess and ensure services are leading to equitable care, titled Health Equality versus Health Equity, Why Knowing the Difference Matters. Moreover, on August 23rd at 2 p.m. Eastern Standard Time, Ariana Gordillo de Vivero, Director of Strategic Initiatives at the National Association of Free and Charitable Clinics, will address tangible ideas and tools that leaders may use within their own organizations to promote self-care and well-being, titled Mental Health, Self-Care, and Burnout at Free and Charitable Clinics. We dropped the registration links for these events in the chat, and we really hope you can join us. Moreover, another plug, as part of this program, we are conducting 20 to 30-minute interviews with community health centers, free and charitable clinics, and federally qualified health centers to understand how the healthcare workforce was impacted by the COVID-19 pandemic. These interviews intend to amplify voices like yours, to inform solutions and resources to improve the healthcare worker experience. To find out more about this initiative or to participate, please reach out to research@healthcareready.org or call us at 202-240-1803. Lastly, on the topic of wanting to hear your valuable thoughts, please complete the post-survey training. It shouldn't take more than a couple of minutes, and your feedback will help us inform the success of this program. And with that, I conclude. We hope you have an amazing rest of your week. Thank you very much, everyone.